to introduce Dr. Kurt Woeller from America to all of you today. I have personally been consulting with Dr. Woeller for the last 15 years. It's a very long time. And he has been so supportive for many, many years and helped me countless times when I've needed treatment for two of my boys who received an autism diagnosis. Dr. Woeller is an autism physician. He is a specialist in the field. He has over 2 decades of experience treating individuals on the autism spectrum, and he's received wonderful results over the years. He is the author of a book called The Road to Recovery, and he works very closely with a laboratory called the Great Plains Laboratory. He has been a pioneer in distance doctoring, and he has consulted with thousands of patients over the last 2 decades living in other international countries. He created the Autism Recovery System, which is a step-by-step guide and will help you through the confusing, sometimes unsure territory of biomedical intervention. So welcome, Dr. Woeller. Thank you for being here today, and it's so wonderful to have you.
Well, thank you, Alana. It's a pleasure to be here. So yeah, thank you very much.
Dr. Woeller, tell us a little bit about yourself and how you got involved in the autism field.
Yeah, I graduated medical school, did my postgraduate training, and finished that up in the late 90s, actually. And I was back in my home state of California at the time, practicing in a clinic. Fortunately, I was practicing with a doctor who was interested in nutrition and what was called integrative medicine, which was new concepts to me coming out of medical school, but I was intrigued. We got a flyer in the mail. There was something called a DAN conference, Defeat Autism Now. And it turns out it was a biomedical autism conference that was sponsored by the Autism Research Institute in San Diego, California. They're actually still there. And so I went to this conference, and it was all about diet and supplements and lab testing and gut problems, all the things that we know now still. And I was completely blown away, totally confused, but intrigued. And within a couple of weeks, I started getting phone calls into my practice. My practice manager came to me at the time and said, "Are you treating autism?" And I said, "Well, I went to this conference, but I had not seen any child up to that point." Well, it turned out when I went to that conference, they took my name, they took all the doctors who registered and asked if we wanted to become biomedical doctors. And I checked yes. And so within a very short period of time, I saw my first autistic child. And, we did some diet, did some basic supplements, and that's really where it began. I actually, from that point forward, started doing some lecturing in the Southern California area, started getting more familiar. And so it's become a major aspect of my professional life in having worked with now parents throughout the United States and internationally now I've been in practice, 20, going on 24 years.
Wow, 24 years. That's a very, very long time. Can you explain to us what is biomedical treatment?
Well, if you think about how autism is framed from a diagnostic standpoint, and it's categorized obviously as a neurodevelopmental problem that incorporates aspects of language, socialization, and of course we have behavioral issues. But biomedical intervention looks at autism not just from a neurodevelopmental standpoint, but understands that for many individuals, whether it's a child, teenager, or adult, their neurodevelopmental issues oftentimes are linked to underlying biological or medical reasons. Now, in part, that could be genetic, there could be some other hereditary factors, but it's well known now that environmental factors can play a role, whether that's chemicals, whether that's heavy metals, what's also known as mold or mycotoxins are contributing. It's not usually one cause, it's multiple things that are contributing to the problem. And so biomedicine, or another word for it is called integrative medicine, looks at an autistic individual and says, okay, we've got this condition, right? We know that there's behavioral issues, cognitive problems, etc. But is there something medical that's either causing or contributing to it? And so that's the approach we take, whereas conventional medicine says there's typically nothing you can do other than speech therapy, behavioral therapy, and maybe medication if behavior is too bad. So, and this really was started many, many years ago by Dr. Bernard Rimland, who was a PhD psychologist who had an autistic child. And he recognized that his own son did better on certain diets, did better on magnesium and vitamin B6. And he was the one that really spearheaded this approach that became, the early terminology was called Defeat Autism Now, but it was the beginning of this biomedical integrative medicine recognition that these kids or these individuals, many of them are struggling with underlying medical and biological imbalances. And so that's the approach that we take and have now successfully for over 2 decades.
I was also told by the doctor who diagnosed my oldest son, David, 16 years ago, that there was not much that I could do to alleviate the symptoms of autism. When David received the diagnosis, I was told goodbye and good luck. And as you pointed out, conventional medicine didn't offer me any treatments. So I'm so happy that you're sharing with us the history, and I've read so much about Dr. Bernard Rimland, and it's just amazing how he pioneered the biomedical treatment protocol. Tell us what inspired you to write your book, The Road to Recovery.
Well, that book came about after years of working with families, around the United States and internationally, and the success that we were seeing with even some of the core foundational aspects of what biomedicine is. And let me describe what those are. It's well known in autism that digestive system problems are a major comorbid issue. And this is even data coming from the Centers for Disease Control here in the United States, recognizing that cognitive abilities, language, behavior is often negatively influenced by digestive issues, whether that's diarrhea, whether that's constipation, whether that's an infection of some sort. So it's well known that a lot of kids have gut problems. And we know that some kids, when I say kids, by the way, I'm really referring to sort of the whole group of individuals. I should say individuals. Some of them have inflammatory bowel problems. And so when you work on the gut, whether that's by treating infections, implementing different diets like a gluten casein for diet, there can be improvements in the autistic condition. And so we were seeing this for years. And again, this goes back to things that Dr. Rimland found early on. And so I felt inspired to put my experiences, into a book form. And my plan is actually to do a second edition on that book too. So I wanted parents to understand that there is hope, that there is help, that if they have a child who's been diagnosed, that if they get told by their pediatrician or their general practitioner or the neurologist that there's nothing they can do, it's completely false. In fact, I've even had parents come to me where their doctors have told them, oh, don't bother with that diet because it doesn't work. Or don't do supplements because, those aren't helpful. And that can't be further from the truth. Basically, what you're getting is false information from practitioners who doesn't mean they're not well-meaning people. They just don't know what they're talking about. They don't have any experience in these types of things. And so there is help, there is hope, and there's a tremendous amount that can be done. And there's many kids that have recovered who will continue to recover, from this condition. That doesn't mean every single child will, but I firmly believe that every individual with autism, regardless of what triggered or what the developmental aspects of their autism were, can at least be helped in some way. And to me, the biomedical approach is absolutely essential in that process. Speech therapy, behavioral therapy, physical therapy, those are also helpful and complementary. But if you've got a gut infection, or if you have food sensitivities, or you have some kind of chemical exposure, those kinds of things need to be dealt with too. And when they are, there's often greater improvement that we see for autistic individuals. So that's really kind of a little bit of a background, but also what was the inspiration for the book that I wrote, and then eventually what became some of the educational websites that I have.
Dr. Woeller, I love how you use the words help and hope. I spoke to a parent last week who was consulting with me, and she told me that she went to the top developmental specialist in our city in Johannesburg, South Africa, and the specialist did make the diagnosis of autism for her 3-year-old son. And when he made the diagnosis, he said to this parent, and don't believe the rubbish that you read. Special diets won't help you. In fact, the parent had told this doctor that she'd taken her son already off gluten and dairy because she'd started reading about these things, and she was reading about a possible autism diagnosis. And this developmental specialist, who is considered the top person in our country, said, I want you to put him back onto gluten and dairy. And so I also like that you shared with us that there is a tremendous amount that can be done. And so many parents receive the diagnosis of autism, and then they are left with no solutions, no information. It's like, your child has autism, accept him, and don't believe the things that you read that actually say that these children can be helped. And, I love that you speak about recovery. I take a lot of criticism sometimes in our country because I use the words recovered. And for the old school in South Africa, this is news, and they find it very hard, to come to terms with the fact that things have changed. We do know more. There has been research, and there definitely is that gut-brain connection. So I'm very happy for our parents to be hearing this from you today. Now, a lot of parents will tell me that their child is a picky eater. What does it mean if a child is a picky eater?
Well, there can be a number of reasons. Picky eating can occur because of some kind of sensory problem in their nervous system, where they don't like textures of certain foods or the way it smells. So there may be a sensory behavioral issue. Sometimes the picky eating comes about because they don't feel good within their digestive system, right? I mean, just think of yourself as an adult, right? There's certain foods you can eat and not tolerate, and so you avoid them. But many autistic individuals don't have language, so they can't express themselves and tell you how they feel. So they only can, they avoid something or they act something out. The other reason that picky eating can occur is that some of the foods are causing a chemical reaction in the brain. And this is a known fact to occur scientifically through the actions of certain chemicals in gluten and casein. So gluten found in wheat, casein found in dairy, cow dairy. And these are chemicals that have an opiate effect. They actually have an opiate chemical structure that interact with the brain and nervous system like an opiate medication would. And this can affect brain function that in some individuals can lead to limited intake of foods or limiting dietary choices. So let me go back real quickly, Alana, to the comment about this doctor. And this is something I've seen over the years, right? Um, you know, a number of conventional docs will say, your child's autistic. By the way, there's no cure. We don't have any options for you, but make sure you don't go do the diet and supplements because, that doesn't work. And then somebody says, well, is it harmful to try a diet? Is it harmful to try some supplements? Well, no, it's not harmful, but don't do it because it doesn't work. So you'll have practitioners who clearly don't know, right? They don't know, and they'll make a comment, and they're just ignorant of the facts. Unfortunately, you'll have practitioners who make comments about something they know nothing about, but they'll say something derogatory anyway. And doctors are classic for this in that many of them will give an opinion about something they know nothing about. And some of it's because they're lazy. Some of these doctors haven't opened a research article in 20 years. I mean, there's all different kinds of scenarios. As a parent, you have to look at things and think, does it make sense in what I'm reading and what I'm hearing? Does it ring true to me? I mean, there are so many different types of chronic health conditions that are influenced by diet. It doesn't mean it's the sole cause, okay? But you don't have to dig very deep anymore into medical literature, even into just sort of common public information about how diet can influence other health conditions: Alzheimer's, Parkinson's, multiple sclerosis, rheumatoid arthritis, inflammatory bowel disease, anxiety, depression. I mean, so this is very well-known common things. It's just that you have some practitioners who either choose not to look or don't really bother to put any work into it. So again, if you're hearing those kinds of things, if they're getting a negative response, seek other opinions and continue to seek information. I wouldn't be doing this, okay? I wouldn't be sitting here for 20 plus years if dietary intervention didn't work. Okay, why would I waste my time and waste families' times by suggesting interventions that are not helpful? So same with supplements, same with other things that we do from a biomedical standpoint. That doesn't mean that everything that is recommended is going to help in the same way for every single child, right? Each child is still an individual. But by and large, what we implement, gut treatment, diet, supplements, are helpful and many times significantly helpful for a good 80%, 85% of individuals that we work with. So those are pretty good percentages.
That's really good advice. I want to ask you this question. A lot of the parents will say, my child will not fall to sleep. They will not stay to sleep. We are exhausted. We cannot function. Why do children with autism have sleeping problems, and what are the possible solutions?
That's a great question. In many kids, some of it can go back to diet. So there could be food sensitivities that trigger stress hormone release at nighttime that can interfere with sleep. There may be certain nutritional deficiencies that can contribute to it as well. Of course, there are sensory imbalances within the brain and nervous system that can affect sleep. I've actually had some kids who have chronic gut pain at night. So what you have to do is go through sort of a litany of questions, and from a clinical standpoint, reflux, for example, can lead to sleeping problems. But again, if a child is having reflux of acid into their throat, getting chest pain, they can't tell you about it. They can't come up and say, hey, mom and dad, my chest hurts, right? They're just not sleeping or they're agitated. The other thing that can happen is that there's a lack of production of a hormone called melatonin. And melatonin is the molecular equivalency to darkness, but there's been some studies that have shown that certain autistic individuals don't produce it in an adequate amount or produce it in a correct timing fashion that helps people to sleep. So sometimes a melatonin supplement can help, 1 milligram, 2 milligrams or so, about an hour before bedtime. That could be helpful as well. And sometimes that works like a charm. I wish it worked in every single situation. But we have to start looking at things medically. Okay, are there food sensitivities? Are there gut problems? Are there other environmental factors that might be interfering with sleep? I've actually had some kids sleep being interfered because they have a computer or a laptop or a cell phone sitting next to their bed, so just the electromagnetics may be playing a role too.
I've been giving my oldest son, David, who's now 18, melatonin for more than a decade. So if he gets his melatonin, he can go to sleep. If he doesn't, he can have a hard time. But I do know, and I agree, that melatonin has helped a lot of kids. And as you say, it can be reflux, it can be food allergies, it can be tummy pain. David used to suffer from a lot of tummy pain at night, and I used to give him pain medication for that, and it would settle him. Dr. Woeller, tell us about the tests that parents can do for their children. When I consult with parents and I tell them, you need to do blood tests and urine tests and stool tests to determine what's causing the autism symptoms, I can see the astonishment on their face. And I'll tell them there's this laboratory in America called Great Plains, and you can send the test kits over, and the information is going to really give you what you need so that you can plan a treatment protocol with your doctor. Tell us about the most important tests you recommend. And I know it's always going to be child specific, but what are the top 5 tests you would recommend?
Perfect. So I break tests down between non-blood draw test and blood draw tests. So we know that getting a blood draw on a child with autism can be challenging, or even a teenager or adult. So it's not that doing a blood draw isn't important at some point, but there are many tests that we can do that don't require a blood draw up front. So the first one is the organic acids test. Great Plains Laboratory has been around for many years. I've worked with them, I lecture for them, and I've also used their tests very successfully in my practice. So it's called the organic acids test. And what organic acids are, these are chemical compounds that we all produce in our body. And when you have imbalances in certain organic acids, it can indicate some kind of metabolic or biochemical problem. The organisms that live in our digestive system, like yeast, like bacteria, also produce organic acids. And those are reflected on the test as well. And so elevations of certain organic acids are indicative of candida or indicative of other yeast or mold exposure and even certain bacterial problems. And some of these organic acid chemicals can adversely affect our body, affect the brain and nervous system, for example. So the organic acid test, which is a urine test, to me it's the hub of the wheel. It's the place to start. I always tell parents in my practice, if you can only afford to do one test right now, right in the beginning, do the organic acid test. If we can do other things, fantastic, but at least we can start with this because it gives some inroads into digestive imbalances and other metabolic problems. A complementary test to that is called a comprehensive digestive stool analysis. And this is simply looking at healthy bacterial levels, pathogenic bacteria, parasites, inflammation, digestive markers. So the organic acid test and the comprehensive digestive stool test complement one each other. But again, if you can only do one right now, it would be the organic acid. Another test that in this, I like your 5, by the way, 5 most important. So a food IgG test. Now, IgG is an immune chemical that gets produced when we've been exposed to a virus or we have a food reaction of some sort. We'll produce IgG antibodies. And that test is helpful because elevated IgG to a certain food can trigger inflammation. We know that inflammation can affect the gut, it can affect the bloodstream, it can affect the brain. There's a lot of studies in IgG food reactivity that's linked to worsening situations in autism, worsening behavior, language problems, cognitive problems, but it also applies to other types of health disorders. They've linked it to IgG reactivity to psychosis, depression, anxiety, bipolar, migraine headaches, joint pain. Okay, so that's an important test. Great Plains actually has a blood spot. It's a finger prick. So people can do these tests at home. The fourth test that I recommend people do is a hair metals test. And the reason is a hair analysis provides a snapshot of mineral imbalances. You're not going to be able to assess all minerals equally to what you would get from a blood test, but it does a pretty good job for common minerals like zinc, manganese, selenium, and lithium. I actually find a lot of autistic individuals very low in lithium. And people hear lithium, they think the medication, but lithium is actually a very important mineral in our bodies because it helps protect the brain against stress. So when our bodies are low in lithium, there's a greater chance for anxiety, irritability, and panic type of responses. And then the fifth test, as far as this, initial set, is what's called a mycotox profile. Mycotoxins are toxins produced by mold. And this test is relatively new. It's been out a couple of years. I wish we had it a long time ago, because what we're finding is a lot of people with chronic health issues, particularly brain neurological problems, are harboring these mycotoxins in the body. And some of them can have really profound negative effects. For example, there's a specific mycotoxin called ochratoxin that comes from Aspergillus mold. Well, in autism, it actually inhibits certain neurochemicals in the brain that can affect attention, affect behavior, affect a child's ability to learn. So those are really my initial 5 as far as the non-blood tests go, always starting with the oat and then incorporating the other 4 along with them. That's where I would start.
I have done the organic acid test many times for both my boys, and it's always really been so useful to see the results, understand the interpretation, and it's really guided me on the treatment protocols for both of them. They really are amazing tests. And, I love the 5 tests that you chose because as you said, we don't have to take the child necessarily for a blood draw. I've taken my kids for many blood draws over the years, and I have many stories to tell about those blood draws. I mean, you come out of there and, you just want the earth to swallow you up because you had to sit on your child and you had to hold them down and they were screaming and everyone was watching you. So I think it's really encouraging for parents to learn that you can do a urine test, a hair test, a stool analysis test. And I've worked with Great Plains many times over the years, and they're such a fantastic laboratory that I really highly recommend. It's not as hard as parents think. Parents will think, I can't use a laboratory in America. I need to use a laboratory in Australia or in the UK or in South Africa. It's actually so easy. It's not as complicated as you may think. So really take a look also at the Great Plains website, which we'll put at the end of the podcast, so you can go take a look at the tests that Dr. Woeller shared with us. Dr. Woeller, on your website, you talk about your 4 pillars to treatment. Please share those.
The 4 pillars came about, again, years back, in just my working through all of the different logistics of biomedical integrative medicine. And I don't remember exactly when it kind of hit me, but I started looking back at my practice going, about 80% of the individuals I'm working with tend to do very well with 4, fundamental treatments or treatment categories. And it came down to diet. Diet was number one on the list. And I say this to other patients with other health issues as well, whether it's an autoimmune problem or chronic fatigue or some neurological issue, is that if we don't improve our diet, it doesn't matter how comprehensive your supplement list is, you're not going to really move the needle that much. Now, so diet is really key, and that could be a whole other discussion on diets, but just a improved diet, healthy diet, and then removing foods that tend to be reactive. Okay, the gluten, casein, for example. So that's pillar number one. Pillar number two is foundational supplements, and there's a whole list of supplements, right? You know this, but when we look at the restrictive nature of diets for many autistic individuals, okay, where they don't want to eat a diversity of food. I mean, I've had kids that will eat like 4 things. Okay, and so as a child, we know, and this has been also studied, many of them are nutrient deficient in certain things. And the problem in not getting nutrients at a young age is, think about the metabolic energy that goes into just normal development as we grow, and how fast kids grow. The brain needs a lot of metabolic energy. The digestive system needs a lot of metabolic energy. And if we're not getting the essential nutrients, right, the system becomes compromised. And so to me, foundational supplements, multivitamin, mineral, essential fats, calcium, magnesium, these types of things, they help to fill in the gaps nutritionally and help to support certain critical biochemical systems that may be under supported. So that's always critical. The third pillar goes back to the whole comorbid situation in autism with regards to gut problems. We know that autistic individuals tend to have a lot of gut issues, and many of them have overgrowth syndromes, yeast, including candida, digestive bacteria, sometimes parasitic infections. And so we have to work on the gut in order to help try to heal the rest of the body, because there's actually a communication network on multiple levels between the gut and the brain. The fourth pillar is what's called methylation. And this is a larger topic, but methylation chemistry in our body is really critical for brain development. It supports language, it supports eye contact, it supports environmental awareness, it supports detoxification, immune function. There isn't really one component or an area in our body where methylation doesn't have some influence. This is also one of the areas that's been heavily researched in autism too, is methylation imbalances. And so there are different supplements that can help support methylation, but it's understanding that methylation imbalances that could be occurring because of a B12 deficiency or a folate deficiency or some type of genetic influence. And those 4 categories are critical. And I'm a real stickler on this. I mean, I've done a lot of different therapies, and I recognize there's a lot of other great remedies out there. But I've always been concerned when I have somebody who says, my child has heavy metals issues. And so they want to jump, their first entry point into this approach is to start trying to detoxify heavy metals. Okay. And I'm like, that's an okay, heavy metal problems can be real, right? We know that some kids have high levels of lead or mercury or arsenic, but you still need to come back to the fundamentals and the foundations. We still need to have a good diet, good core supplements, good healthy digestive function and methylation support, so that when you implement some of these other strategies, whether it's heavy metal detox, whether it's hyperbaric oxygen therapy, whether it's immune therapies, whatever it is, those other therapies generally have a better chance of working when you've worked on the foundations. And so that's what the 4 pillars are. And that's actually been a fundamental aspect of what I've done professionally, what I've written about, and what I teach about through my different online courses.
When my youngest son was showing the symptoms of autism, we started treating his methylation cycle very early on. And it was so interesting to see how supplementing him with folate had such a dramatic result. I mean, within 48 hours, I started to see an alleviation of the autism symptoms. For Erin, it was dramatic. You know, it's not always going to be for every child. And if you try something, sometimes it could not be working because you may need to increase the dose or play a little bit with the times of day you're giving the supplement. But we really saw an improvement in his language skills when we started to supplement folate. And when I actually did his DNA analysis, we could see there was a NTHFR methylation issue for him. I know that we're running out of time. I wish we had more time because I actually have so many more questions to ask you for our followers.
But just have to have me back.
We will definitely have you back. My head is exploding with the questions I actually have to ask you. So we're going to have to schedule another day to do another podcast. But before you go, I would just like to ask you, how can parents get in touch with you, and how does the autism recovery system work?
So I have my private practice, and it's called Sunrise Functional Medicine. I work with people all over the world. So the best place, the website is mysunrisecenter.com. The email, that's the best way to contact us or contacts my practice manager, Lee, is scmedicalcenter@gmail.com. And Ilana, I can email this to you too if you want to post it, just so you have it.
Yes, please send me that email, and I'm going to put the details at the end of this podcast, and we'll also post it on Facebook, Autism Now What, for our followers, so that they have your contact details.
So that's my private practice. And then the Autism Recovery System, it's autismrecoverysystem.com. Now that's a membership site that people can join, and they can have access to me through the question and answer forum. There's actually a place to message me privately. There's videos, there's articles, there's an entire biomedical course that's part of that site as well. So it's a biomedical education site, but it's also an outreach to me. Many people who are members of Autism Recovery System will also consult with me privately, but there's many people who are members of the site who may be working with other practitioners who just want to ask a question, hey, what about this supplement? Or my child has this behavior, what could that mean? So it could just be having a dialogue. So autismrecoverysystem.com. There's also a website called labtestsplus.com. Now, that is a place where people can actually access many of the Great Plains lab tests. And there's some other lab companies on there as well. One of the other benefits of Lab Test Plus is that when a lab is ordered through that website, a written evaluation, when we get the results, we'll sit down and do a written evaluation of the most relevant markers on the test. So if I get an organic acid, I'll talk about what are the most relevant markers, and then make what are called action step suggestions. This is what the marker means. Here's some things to consider. So it's a lab test ordering platform that also comes with some personalized written interpretation. So you're not just getting a lab that you don't know how to interpret. Okay, so there's my private practice, which is my Sunrise Functional Medicine. And then there's the Autism Recovery System website where people can interact with me on an ongoing basis. I mean, I have people who post me questions every day through the forum of that website. And then there's Lab Test Plus. Real quickly, if you have, and I don't know if there's practitioners out there, sometimes a parent may be a doctor themselves. I also have some professional websites for healthcare practitioners. I actually have an entire course that is very comprehensive, designed for healthcare practitioners, called Autism Mastery Course. And that's the website, autismmasterycourse.com. And then we have a website for healthcare practitioners called functionalmedicineclinicalrounds.com. And that's a place where practitioners can join and then ask questions, do one-on-one consults, things like that. So and there's a lot of websites. I don't want to overwhelm people. I'll send all this to you, Alana, so you have it. But yeah, I'd be happy to come back too. We can do a part 2 of this, maybe even a part 3, whatever you want. I can always make myself available.
I'm so excited. I think we're going to have a lot of parts. This is just the beginning. And over many years, many South African parents have very successfully communicated with you using the autism recovery system. There have been doctors from South Africa who have attended your doctor's courses. You know, Dr. Woeller, when I hear you talking about all the things that you offer and your achievements, it's impressive. And I want to really just thank you for the wonderful work, for over 2 decades of hard work and initiative, and for what you've done for so many parents and children with autism around the globe. Thank you from the bottom of my heart. On behalf of the autism community around the world, you are such an amazing specialist, physician, specialist in autism, and we are very grateful to you for everything that you've done for so many children over the last 20 years. So thank you for joining us today. Thank you for joining us today, and very soon we will announce to our followers when we will be launching part 2 of our podcast with Dr. Woeller. Thank you so much, Dr. Woeller.
Thanks so much. Take care.